Hello, my name is Shirley Wood, and this is my substance abuse presentation on fentanyl. Fentanyl is a synthetic opioid that was initially introduced as an intraoperative anesthetic in the 1960s. Fentanyl was first available in the outpatient setting in the 1990s as a transdermal patch for analgesia for cancer-related pain and chronic pain conditions. Fentanyl is 75 to 100 times more potent than morphine. Fentanyl binds to opioid receptors in the nucleus accumbens and basolateral amygdala. Fentanyl is highly lipid soluble, which makes it very easy to cross membranes. Due to its potency, fentanyl is highly addictive. Fentanyl triggers the mesolimbic reward system and causes cells in the ventral tegmental area to release dopamine in the nucleus accumbens, which causes euphoria. Opioids have been abused since 3000 BC by use of opium derived from poppies. The isolation of morphine from poppies in the 1800s led to an increase in opiate use. In the late 1800s, heroin was available commercially, and in the early 1900s, heroin was being abused intravenously. The rise in medical advancements in the 1900s led to formulation of analgesic compounds for use in the surgical arena. Treatment of chronic pain in the form of prescribed opioid analgesia started an epidemic of opioid abuse and death. As an opioid crisis waged in the United States in the early 2010s, laws for opioid drugs decreased the number of prescriptions. Individuals who were previously prescribed opioids for pain management turned to purchasing opioids in the form of heroin or diverted prescription pills. Fentanyl is easy and inexpensive to produce. As the supply of prescribed opioid pills available for purchase on the street dwindled, the use of fentanyl increased exponentially. Due to the availability of fentanyl, a greater number of people were introduced to the drug. Fentanyl is abused either by injection, which carries a high risk of lethality, oral ingestion of pills, inhalation of powder, or inhalation of fumes. Fentanyl is mainly manufactured in China and Mexico. Fentanyl is then trafficked into the United States, usually via Mexico. As fentanyl is a synthetic opioid, it has no geographical source boundaries like cocaine or heroin and can be manufactured anywhere. Fentanyl is readily available in all 50 states. The prevalence of fentanyl overdose has a percent increase of 297% from 2016 to 2021. 71% of all opioid deaths occur in the 25 to 54 year age groups. 7 out of 10 deaths involve males who statistically tend to be less educated, unmarried, unemployed, and living in rural areas. Young adult males are at high risk for fentanyl abuse. Males that use fentanyl are typically unmarried, have less education, and are unemployed. Other risk factors for fentanyl use include being Caucasian, homelessness, recent release from incarcerations, psychiatric disorders, heavy alcohol use, and history of polysubstance use, especially cocaine. Fentanyl causes euphoria in users as dopamine is released into the nucleus accumbens. Respiratory depression is the most dangerous side effect of fentanyl. Respiratory depression from fentanyl is dose dependent. Due to the binding on mu-opioid receptors, fentanyl disrupts the beta-arrestin pathways, which cause respiratory depressions. Respiratory depression occurs for several minutes before the user realizes it, which increases the risk of death. Fentanyl also may cause cardiac complications such as myocardial ischemia, QTc interval prolongation, and bradycardia. Fentanyl produces long-term effects on the endocrine, immune, cardiovascular, respiratory, gastrointestinal, and neural system. Use of fentanyl and other opioids increases the risk for fractures and infections. Fentanyl also lowers the pain threshold and makes pain management difficult. The endocrine system is affected by inhibition of the hypothalamic pituitary axis that disrupts gonadotropin releasing hormone that decreases testosterone and estradiol production, which causes decreased libido, impotence, menstrual cycle disruptions, and infertility. The decrease in sex hormones also causes decreased muscle mass and bone loss that results in an 80% increase in fractures. Respiratory infections such as community-acquired pneumonia are also increased with the use of opiates. Cardiovascular complications associated with long-term opioid use include hypotension, orthostatic hypotension, pulmonary edema, syncope, sinus bradycardia, supraventricular tachycardia, and atrial fibrillation. The use of opioids also increases the risk of heart failure and myocardial infarction. Constipation is a frequent gastrointestinal side effect of fentanyl use. Fentanyl causes changes in sleeping patterns, and complaints of insomnia are frequently encountered. Poor concentration, confusion, and lack of focus are also commonly associated with the use of fentanyl, as binding of the mu receptor causes a change in cognitive function. Upon a physical exam, this may be observed as decreased reflexes. Changes in mood and loss of motivation also occur with fentanyl use. Pupillary meiosis also occurs when somebody is under the effects of fentanyl. As with many substance use disorders, avoidance of friends and family, lack of interest, financial difficulties, and an increase in risky behavior to obtain the use and use fentanyl are common. The potential for overdose or use as a suicide weapon is very high with fentanyl. As fentanyl causes dose-dependent respiratory depression quickly, the risk for overdose is elevated. Overdose is common with fentanyl use as it is illicitly produced. From pill to pill of fentanyl, the dosage is inconsistent, and one pill may cause an overdose. Fentanyl carries a high risk for use as a suicide weapon. It is estimated that up to 30% of accidental overdoses are actually suicide attempts. There are several options for pharmacological treatment of fentanyl use. There are three main types of treatment options: full agonists, partial agonists, and antagonists. Methadone is a slow-acting, full opioid agonist that does not produce euphoria. Buprenorphine is a partial opioid agonist that blocks the opioid receptor, which prevents withdrawal and cravings. Naltrexone is an antagonist that completely blocks the opioid receptor, which in turn does not allow opioids to occupy the space and also decreases cravings. Naloxone quickly removes and blocks opioids from mu receptors and is used to reverse overdoses of fentanyl. Treatment of opiate use disorder may also consist of psychopharmacological agents, as those with opiate use disorders commonly have co-occurring mental health issues. Non-pharmacological treatment for opiate use disorder consists of psychotherapy. Group therapy, 12-step group therapy, such as Narcotics Anonymous, can also aid in recovery. Cognitive behavioral therapy assists with reinforcing coping mechanisms and relapse prevention. Patient education is dependent on treatment type. During recovery, it is not uncommon for a patient to experience a relapse. As a provider, using harm reduction theory, continuation of opioid treatment options may be beneficial for the patient. Educating patients to not use fentanyl when alone can reduce the risk of overdose or death. Providing Narcan for this patient population is highly encouraged. Referrals are needed for cognitive behavioral therapy, group therapy, and resources for free Narcan. Depending on the treatment type, follow-up will vary. For example, for patients just starting on opioid replacements, follow-up may initially occur daily. As treatment progresses, follow-up is usually weekly. However, this may differ depending on the type of treatment opioid replacement. Methadone is typically distributed daily. Conclusion: fentanyl is a potent, rapid-acting synthetic opioid originally developed for use in hospitals. During the opioid crisis, legislation changed, and those initially prescribed opioids for pain turned to alternate sources for pain management. The trafficking of fentanyl in the United States increased, and a new opioid crisis emerged. Fentanyl has a high risk for accidental overdose due to respiratory depression. Due to its potency, fentanyl is also used as a suicide weapon. Those most likely to use fentanyl include the unemployed, those with mental health conditions, including other substance use disorders, males, and those aged 18 to 25. Treatment of opiate use disorder consists of pharmacological treatment with agents such as methadone, buprenorphine, and naltrexone. Cognitive behavioral therapy and group therapy are also beneficial interventions.